My goal today is to talk about vaccination and communication strategies you can use to describe to the various players involved in vaccination as to what you're going to achieve with your vaccination program. I'm going to view this from the perspective of an animal disease manager, not from the side of a communication specialist. And it's important to recognise that, like avian influenza control, there is no one-size-fits-all system or approach to communication. You will have to adapt your communication strategy to your own local situation. I'm going to do this by considering the communication requirements in a developing country and assuming that I am the CVO of that country who has decided to implement a broad-scale vaccination campaign. Now, although I'm talking about a developing country, most of these aspects will be applicable to a developed country. Now, this first overhead is one you're going to see throughout this presentation, and it demonstrates that you have very many people and many different players and stakeholders who you have to engage when you're actually involved in your communication strategy. As the CVO, your objective is to make sure that the vaccination campaign runs smoothly, and that can only be done if you have full cooperation from all the players that we see on this table. Before I go around that table, though, and address each of the different groups, there are a few points that need to be done before you consider your communication strategy. And the first of these is to define very, very clearly the reasons why you are going to be performing vaccination. Are you trying to eradicate the disease now? Or is that something which you'll be doing, say, in 5 or 10 years' time because you already have endemic infection? Or are you just trying to control the levels of infection or reduce the levels of exposure of the human population because you have large numbers of human cases of disease? Also, you need to look at where you are in the stage of your control program. In many countries in Asia, for example, we know that it's going to be a very long-haul process to go from where we are today to eradication. And so we need to therefore establish why exactly we're using vaccination in that control program. Because there are many stakeholders, we have also many different communication messages, because these groups are different. We deal with the public, we deal with government, we deal with outside organisations. And so the message for each of these groups will be slightly different in the way you deliver it and also in the content. And so we have to use different approaches to communication. You will not get universal support for your vaccination campaign. So you need to anticipate the opposition you'll have from various groups to vaccination, and to work out what are my answers for this opposition. And that comes by defining clearly the reason for your campaign. If you do that and you're clear on why you're vaccinating, then the opposition will be less of a problem, because you will actually know very clearly why you're vaccinating, and you'll be very sure of your scientific information for your vaccination campaign. You need to use communication professionals. As veterinarians, sometimes we can get message across to government. We are probably less able to do that in a proper manner to the public or to the media. So always make sure when you're dealing with communication strategies to employ either in-house or external people who can help you with your communication strategies. They will pay dividends when you do that. But it's also important to make sure that they realise they're working for you. You're the person who is trying to get the message out, and they need to put out your message. So make sure that your communication people are actually prepared to do the job you want them to do. And again, not as a communication specialist, but it's important to recognise that your communication should be science-based, because that's what you're about. As a scientist, as a CVO, you have to make sure that what you're putting out there is sound information. It needs to be clear, it needs to be consistent. And people talk about the 5 C's of communication, and I think these are very important. So your communication must be clear, it must be consistent, it must be correct, in other words, scientifically correct, and also making sure that everyone's talking the same message. It must be creative, otherwise people aren't going to listen to what you have to say, and of course it has to be coordinated. So let's start by going back to my diagram and looking at how we go about getting approval to undertake a vaccination program. Unfortunately, CVOs in this day and age have lots of political masters, and we have to make sure that the program we have is approved at a high level, And this can be both government and also maybe a regional thing. For example, in the European Union, you have to actually get your vaccination campaign approved by the Commission before you can actually embark on it. So there's lots of communication needed and lots of persuasion needed. Dr. Ilaria before has already mentioned the vaccination campaign in Italy, and she can attest the amount of work she had to do to convince people of the need to vaccinate in Europe. You need to sell the benefits of vaccination to your political masters, but you also need to highlight the potential pitfalls that can happen with vaccination, but also how you will overcome this. So you need to give them a balanced view, but highlighting the factors which you think are important as to why you need to use vaccination. Now, vaccination is likely to be implemented after other measures have failed. This has been the pattern which has been observed with most countries, that they try to eliminate the virus using things like stamping out, movement controls, biosecurity, and find that they actually can't achieve it with that alone. And so they then need to bring in other measures to control the disease. And so you need to explain why you are changing direction with your by introducing vaccination. And this has helped sometimes by including this in your contingency plans for avian influenza. So if in these contingency plans you actually highlight when you are likely to implement vaccination, this will help with your communication, because you can then say, well, we tried this, we tried this, and we tried this. None of these are working satisfactorily. We need to now include vaccination. And if that's already is already in your vaccination plan, your contingency plan, then you have a much easier job to do that. When you present this to government, you need to provide a well-constructed plan of how the campaign is going to be administered and how it will operate. And again, this will help you with your communication, because if you do this properly and set out all the steps of how you're going to do the vaccination, it makes communication to other people much easier. So some of the things you'd include in that plan are, well, why are you going to use vaccination? What is the vaccination going to achieve? What's the purpose? What's your target population? How long will the campaign last? And what are the signals for stopping vaccination? So when are your review points? And what is your exit strategy? Now, your exit strategy may be many years away, especially in endemically infected countries. But at least you have to have some sort of review points along the way to say, well, this is when we're going to review our vaccination and the need for continuing vaccination, whether we need to continue vaccinating all of our original target population or whether we can stop vaccinating certain sectors of the poultry population. You're going to have to give evidence or experiences from other countries when you develop your plan, so people see that you're not just doing this on your own, that other people have also used vaccination and what the successes and failures of vaccination have been elsewhere. You'll need to show how you will actually measure your success. So what are the criteria you're going to actually say are my values for success of a vaccination campaign? Is it a fall in the number of human cases of avian influenza? Is it a reduction in the overall prevalence of disease? Is it disease eradication? But be clear about what your indicators of success are, because your vaccination campaign will be judged against those. Again, this comes back to defining the purpose of your vaccination campaign in the first place. What's it going to cost? Vaccination campaigns, especially broad-scale mass vaccination, can be very expensive because you may be having to vaccinate almost an entire country's population of poultry, and these populations turn over 2 or 3 times per year in some sectors, and so you have very, very high costs of vaccination. And that raises the question of who pays for vaccination. Is this a public good activity? And in fact, when we're dealing with avian influenza, H5N1 HPAI is in fact a public health issue, because we're worried about the possible emergence of a pandemic human virus from an avian strain, and so controlling of virus at source in poultry is a genuine global public good, and therefore government has a responsibility to pay for that, especially in smallholder poultry. But they're also private goods as well, and you'll find that your large industrial farms will be more than prepared to pay for vaccination because they will see the benefits themselves to this vaccination campaign. But what are the benefits? And often it's very hard to put a dollar figure on that. For a large intensive farm, it's quite easy because the farmer will say, well, if I vaccinate for 10 years and don't have an outbreak, then I know that I've saved this amount of money. But when you're talking about human life, it's very hard to put a dollar figure on the value of a vaccination campaign. What vaccine will you use? And this issue has already been discussed by many people, and the key here is to use the vaccine which is best suited to your own country's situation. Is vaccine available? Where are you going to get it from? And will you have guaranteed supplies of vaccine for the duration of the campaign? And what is your target population? Are you doing all poultry? Are you doing certain sectors, certain species? Will you vaccinate pigeons? Will you vaccinate geese? All these things need to be worked out when you're actually determining your plan for the program and communicating this information to your political masters. We now move on to trading partners, because when you implement vaccination, you may find some opposition to trade from your trading partners. So if you are an exporting nation, you need to work in advance with your trading partners to establish the effects on trade and also the new rules for trade once you start vaccinating. But this needs to be done in advance. If you try to do this when you're trying to implement a vaccination program, it's going to delay the introduction of vaccination and is something which you need to have established well and truly before you even decide to implement the program. For those countries which are using vaccine perhaps in their smallholder sector but not in their large farms, they should consider the issue of compartmentalisation, which has been discussed by others already in this program. The situation in Hong Kong is one which is worth looking at, because Hong Kong required all poultry coming in from mainland China into the Hong Kong Special Administrative Region to be vaccinated. So again, there's different ways you can look at these problems to make sure that the poultry that you are getting meet your requirements. And so again, you may not be just thinking about trade of exports, you may have to think about imports as well. Our next group of people are the international agencies like OIE, FAO, WHO, and how we should be communicating and engaging with those. And you'll find, in fact, that as a developing country, often FAO and OIE will be engaged already in the design of the vaccination program. And if they're not involved, then you should actually get them involved, because they do have a major role to play to support the program and to help you in designing the program which you're going to set up. So this is definitely a two-way communication that's required here. It also needs to be remembered that FAO and OIE see vaccination as a legitimate control tool for highly pathogenic avian influenza. And so you can use this when you're then talking to other parties, that vaccination is not just something you've thought about, it's something which is actually recognised as one of the key tools for control of this disease. These organisations can help you by providing independent scientific advice and also in developing guidelines for vaccine use. In dealing with WHO, you'll need to remind them that they may have to look at their human case definitions, because when you start using vaccination, it will change the pattern of disease. And so you therefore may not see clinical disease as you saw it before. So you may find cases of clinical disease occurring without having clinical disease in poultry. But it's also important to stress that that's a minor issue when compared to the advantages of poultry vaccination, which is that the amount of virus being put out into the environment is going to be markedly reduced. You can also get support from other United Nations agencies such as UNICEF, who've been heavily involved in communication packages for avian influenza in a number of countries in Asia already. And of course, these agencies can be a possible source of funds for certain aspects of vaccination campaigns. And this can be very, very useful for countries which don't have the resources they have to undertake these programs. There are also other important international agencies such as the World Bank, Asian Development Bank, and others in Africa and other parts of the world. And these need to be kept informed of the activities you're going to be doing with vaccination, and they also may be able to support some of the aspects of vaccination campaigns in developing countries. And they too have a lot of expertise from other places and experiences where other countries have used vaccination, and this has been included in programs that the World Bank and others have developed. Going back to your own government now, and you have the issue of communication with other government departments. Again, this is something which has to be considered when you're developing your program. All of these other government departments need to be supportive of your program. So they all have to be singing the same song and all need to be coming on board to make sure they support the program. So again, your health department, much like WHO, has to look at their change in human case definitions. Your health or food safety department has to be convinced that the products from vaccinated poultry are safe, and they need to be able to promote that message. You need to have the financial resources to do the program, so you have to convince Treasury that you need support and funds for this program. So all these people need to be brought on board, and this again requires internal communication. But it doesn't stop there. You also have communication within your department. And sadly, in many parts, many countries and many departments, you do have silo effects where certain sections or certain parts of departments just don't talk to each other. And so you have to try and overcome these silos and get all people involved in this to be on side and to be involved in the program. Because vaccination does cross over boundaries within departments. For example, it may cover the group that's involved in registration of vaccines. Your veterinary laboratories have to be on side to be ready to perform all the necessary post-vaccination surveillance. Your extension services will need to be involved to get in touch with the villages and the communes and the lower level staff. And you may have to deal with international cooperation departments as well within your department to make sure that any aid funding for vaccination is coordinated. So again, this all requires communication. Unless you do it, you'll find that you won't have everyone on board and the program will fail. Now we start moving outside. So all that's been largely intergovernmental or communication with major agencies. Now we move out and we start talking about communication with the media. And we have to view the media as a major asset in promoting the importance of vaccination and in delivering your message to the community. The media will do that. We all tend to be fairly fearful of the media because of experiences we've had where the media may have taken things out of context or blown things up or somehow made life difficult for government departments. But in the case of this, we have to recognise that media has a very, very positive role to play in allowing you to get your message out. Quite often the media will allow you to have free community announcements which can be used to actually put out the message you want. Again, I have to stress, we need to ensure that we use media professionals to assist in dealing with the media. When you're dealing with the media, solid preparation is absolutely critical. So you prepare your press releases, your lines to take, your Q&As, so that when you actually ask questions, you're prepared for what comes and you're not caught by surprise by the media. It's preferable to use one credible spokesperson experienced in dealing with the media. Otherwise, you get multiple people talking, you get cross messages, someone may be less prepared than others. But that's sometimes not possible. The ideal is someone who is technically competent, who can answer the technical questions, but also has the exposure and experience to deal with the media. Now, the media may look for negative stories. That's a fact of life, and you need to try to preempt those to make sure that you know what's going to happen before they do. So you need to know when problems are occurring. Now, that's easier said than done, but again, communication then has to be really, really good from the field level back up to your central level so that you're aware when things are going wrong in the field and you can do something about it and know about it before the media gets hold of the story and then comes knocking at your door asking for information about something you don't know about. And this also includes information in the scientific literature. There's been a number of examples lately where there have been articles in the scientific literature which have been negative about vaccination. And you need to be well prepared with information on these so that you know about those articles, have read them critically and understand what they're trying to say and how that applies to your program. And you also should be looking at using the web as a communication tool. It's such a valuable tool these days, and anyone who doesn't have a website for their government communications is not living in this particular century. I'll move on now to consumers, another very, very important group, because consumers are generally worried. They're getting a lot of information about avian influenza, and many of them are scared. They don't really understand the disease very well, and they don't really understand what happens with vaccination. And so there may be some concerns about, is the meat I'm eating from vaccinated poultry safe? And you need to be able to provide reassurance that is the case. And generally speaking, in the places I've been dealing with vaccination, there's been very little negative reaction to the introduction of vaccination campaigns. And you can point out that vaccination will reduce the likelihood of virus being found in meat, and that's from work that's been done in David Swain's lab has shown that that is the case. If you vaccinate poultry, then you will not get multiplication of the virus in the meat. You need to get advice from communication specialists on the need for communication campaign, so they can advise you what the mood of the community is and whether in fact there is a need to put out additional messages on the safety of vaccinated poultry. Be aware that you might occasionally get cases with birds having granulomas under the skin or in the muscle as a result of improper vaccination. Now, these are not a public health issue, but of course they're unsightly and the consumers don't like to find them. Moving on, we can look now at vaccine companies. And of course, the first thing you have to have is to make sure that the vaccine companies are able to supply suitable vaccines when you need them. And this is something which you'll have to get some sort of forward planning, because you're going to need vaccine for an extended period. Once you choose to vaccinate, it's unlikely it's going to be a one-off dose of vaccine. It's probably going to be a campaign which lasts for some time. But you can also get very, very valuable support from the vaccine companies, because they've been there before, they've been involved in many other vaccine campaigns, and the experience they're getting now with H5N1 vaccination is increasing all the time, and so they can be a very valuable scientific resource for you on information relating to vaccine. There's also a very large group of NGOs out there in the field dealing with livestock issues, and this group also needs to be engaged. They can be very valuable allies because they do know what's happening at the grassroots level, and they have a very good understanding of the constraints you might come up against in effective vaccination. So they're very valuable to use as a resource when you're planning your program. They will be able to advise you whether or not such a program is likely to be feasible. But again, remember that NGOs can have a different agenda to government, and you cannot always guarantee that they'll be fully supportive of your program. But that doesn't mean they shouldn't be engaged. They must be engaged, and they need to understand why the program is being implemented. Again, we move back into government again, and we move to the provincial and district staff, because quite often in many of the countries we're dealing with, the central government does not have direct line control over provincial or district staff. They actually have provincial autonomy, and so the CVO can give directions but has no direct line control over these groups. And you'll notice in this diagram that I've put an extra box up the top in yellow, which is the government, because what we need here is very, very strong support from the highest possible level, so that you have very strong indications from the highest level in government that this is an important program. So if we take the example of Vietnam, the Minister of Agriculture and even the Prime Minister were very heavily involved in promoting the vaccination campaign, and through that they got the cooperation of the various provinces and the provincial departments. So this is an extremely important thing to get right. And if you don't have that, then you won't have a campaign that works effectively. Those countries which don't have strong central government and have independent provinces and districts are having trouble controlling this disease because there is no strong push from on high to have the programs work. So we need to make sure they're fully committed to the program. We need to explain their responsibilities. So who is doing what? What does the central government provide? What is the provincial responsibility, including the budgetary responsibilities? Training, who is going to train? Is it going to be provincial or central? What is the role of the provinces in vaccine storage and distribution? How are you going to keep your vaccine cold if you are involved in that? You need to explain the benefits and pitfalls of vaccination to your provincial and district officers. You need to also look at the plans which the provincial people have developed, and you need to make sure that the provinces provide feedback on issues as these arise. Otherwise, you're left in the dark as a CVO and don't know what's actually happening at the field level. We move on now to the intensive industry, the large commercial farms, who are often represented by some industry body. And you'll find, in fact, that you will get cooperation from this group, because in high-risk areas, they will want to vaccinate their poultry. They'll see this as a commercial decision, a risk decision, and in their opinion, they will say that where you have endemic infection outside of your farms, then you're going to have to get vaccination to protect your farms properly. They'll be prepared to pay for the vaccine. So that means it's not going to be a cost to government, it's going to be a cost to the industry, and they're also going to be prepared to pay for their own post-vaccination seromonitoring. But remember that the intensive industries will also get very frustrated if they perceive that the government is inactive or not being promoting the vaccination as quickly as they would like. So it's a very fine balance you have to achieve there of keeping these industry people happy. But at the end of the day, you need to explain that this is a vaccination campaign which is controlled. It's a government decision as to whether or not vaccine will be used. And so they are not the ones who make that call at the end of the day. You need to explain to these people the importance of monitoring for infection, and so it should be part of the vaccination campaign that they are prepared to introduce some sort of system such as the ones Ilaria has talked about into their flocks, be that the DIVA system or sentinel poultry or some way of monitoring for infection in those flocks. A big issue here is beware of complacency. You have a situation where people think, well, I'm vaccinating my birds now, therefore I don't need to worry about biosecurity. Now, from my experience again is has not been the case in most of the countries using vaccination, but you need to be very strong with that message that if you are vaccinating, that's not enough. Vaccination and biosecurity go hand in hand when you're dealing with these properties. Moving on now to vaccinators and paraveterinarians. And these, of course, are your most important people because these are the ones who will be going onto the farm to actually do the vaccination. And so this means you have a responsibility here to communicate with these people on what they're supposed to do. So they must be fully trained in vaccination. They need to understand aspects of cold chain, so how they're going to keep their vaccine cool during the day. They need to understand disease prevention. The last thing we want to see is for vaccinators to be spreading disease from farm to farm. And we know this has happened before with other disease control programs. So it's critical that these people are trained in the right methods and practical methods of disease prevention when they're moving from farm to farm. It's best to use hands-on training for this group, so they're actually out there with vaccination guns and vaccinating poultry, rather than trying to do it through videos. However, videos can still be a very useful training tool as an initial theory session in which people get to see where they're supposed to vaccinate birds and how they're supposed to do all these activities. The vaccinators need to understand what their target population is, and they also have to be aware of the importance of keeping records of the birds they've vaccinated. The next group we have to deal with are the local communities. And again, these play an absolutely vital role in implementation of mass vaccination programs. These are the people who know the local conditions. They can mobilise local resources to ensure poultry are available for vaccination at the time you come to vaccinate them. And my experience in places like Vietnam is that they have been the most important group to engage. So again, this must come from the highest possible level so that these people are on board and ready to assist at the time when vaccination is required. Our final group we have to communicate with are the smallholders and villagers who are actually producing small quantities of poultry. And these are often a key target in mass vaccination campaigns. And again, these people have to be made aware of what their responsibilities are. And they need to know that vaccination, again, is not a panacea that will protect them from disease. So they need to also, where possible, introduce other measures to control avian influenza. But vaccination will help to reduce the levels of exposure and infection in these birds. They need to know what are the possible side effects of vaccination, because they do occur. Sometimes you'll find some birds develop abscesses in the neck after vaccination, or find that if they're vaccinated incorrectly, they may not be able to feed properly. So the farmers and villagers need to understand what signs to look for, and if they do get a problem, who do they report to? Because they need to be able to be given some sort of support in that situation as a result of the problems with vaccination. They need to understand the importance of other measures to prevent infection, because if they rely on vaccination alone, they will probably find that they do still get infected. Now, it's very difficult to implement biosecurity in a lot of these farms because we're dealing here with free-range poultry, scavenging poultry. And so although we want to try to improve biosecurity, you can't do it in the same way you do it with the large industrialised poultry farms. But there are still measures you can implement which are largely things like changes of behaviour. So, for example, you don't allow people free access to walk on and off your farm. Where possible, you try to segregate different species of poultry. If you bring in new birds, you make sure you segregate those for a period of time. These are all small measures. They don't cost anything, but they're things which you have to communicate. If you don't tell people that these are things they have to do as well as vaccination, then they won't happen. The importance of reporting disease. Again, if they see any signs of disease in their vaccinated poultry, they still have to report it. But they also need to recognise that the disease may not appear in the same form it appeared before, because you have vaccinated birds, and so the level of mortality may be much lower than it was in an unvaccinated flock. In other words, they have to recognise that vaccination is just a risk reduction measure. It is not something which is going to eliminate all risk of infection in their flock of poultry. Of these groups, I think the one which needs most attention are the duck farmers, because for many of these, they don't see avian influenza as their problem. And so this group has to be brought on board, because for other farmers, they recognise that if they don't vaccinate their poultry, they may lose their poultry as a result of disease. For duck farmers, there may be no actual benefit for them directly. So you need to ensure that duck farmers are aware of the reason for vaccination and to actually support them in this program, and to stipulate very clearly that this is a public good program. I'd like to finish off with just a few common concerns that need to be addressed through your communication strategy. And the first of these is the issue of non-sterilising immunity and silent excretion, because as has been pointed out time and again during this series of presentations, you do not get complete sterilising immunity as a result of avian influenza. And so there's been lots of concerns. If you vaccinate, you're still having all these silently excreting birds around, and you won't be able to tell whether or not they're actually infected. But I think a key thing that you need to mention here in your communication is the comparison between the situation before vaccination and after vaccination. Because if you look at what happens in a lot of developing countries, before vaccination, poultry are being sent off to market without any form of testing, without any form of controls, and so you're finding that people will move infected birds to market. And so the situation after vaccination is much better, because at least you're going to have some degree of protection in those birds and therefore less excretion of virus. We've talked about the problem of infection being harder to detect in vaccinated poultry. This is mainly a problem for the human health community, who have case definitions that say that when you're looking for a case of avian influenza in humans, then you should also be looking for sick poultry. But it's also an issue for disease monitoring, because you can no longer rely on high-level mortalities to find outbreaks of disease. The issue of antigenic change. Again, people will say, well, we shouldn't vaccinate because we're going to have, it's going to drive antigenic change, and we don't want to do that. Well, my response to that is that if that were the case, we probably wouldn't vaccinate humans, because antigenic change happens all the time with human influenza vaccination. And so the answer to that, as David has pointed out already, is to monitor this, and where necessary to modify your vaccines if you do find you get antigenic drift occurring in your field strains of virus. One other issue which has come up is that people have been worried about the emergence of a human pandemic virus as a result of the use of vaccination. Now, there's absolutely no reason for people to fear that, but it's something which has appeared time and again in the media as an issue. And I think the key there is to point out that by using vaccination, you're reducing the virus load and also reducing the possibilities of virus to multiply. And multiplication of virus is the key driver of any changes, and especially multiplication in non-avian species. And this will be reduced as a result of your vaccination program, because you reduce the amount of virus being excreted by poultry, and therefore the risk of exposure of other animals will also be reduced. People worry about the exit strategy. We all want to stop vaccinating for avian influenza, and therefore people say, well, you need to start vaccination with the goal in mind of stopping at some point in time. But I think we shouldn't be too bogged down on that in places where infection is endemic, and we realise we are dealing with a long road to go from our current situation of control to the point of eradication. That doesn't mean you shouldn't be developing a roadmap. You must develop a roadmap to show how you're going to move from where you are today with, say, a mass vaccination program to a more targeted program to working towards eradication if this is ever possible. The issue of vaccination and endemicity has also been brought up. And I think it's important to point out that in all the countries where vaccination is being used in Asia, vaccination has followed endemic infection. It has not been the initial cause of endemicity. It's correct, if you do not monitor your vaccination program carefully, you will maintain that endemic state. but I think it's important to recognise that vaccination was introduced in the first place because there was endemic infection. I hope from that very, very brief and broad introduction, it's given you some ideas on some of the issues you have to deal with in communicating with the various stakeholders involved in vaccination. So I thank you for your attention, and thank you.